Hi, my name is Akane. I'm a PGI1 in psychiatry at Texas Tech, Perrin Basin. And today we're going to talk about seasonal affective disorder. This is a subtype of almost depressive disorder that comes along in not all places, but typically places with reduced amounts of sunlight. So it presents like major depression, essentially, with reduced mood and affect and eating off more often, increased sleep, and things like that. So of note with seasonal affective disorder, it is actually more common the further away that you move from the equator. In other words, the less sunlight you get, or the less sunlight people get, the more likely they are to get seasonal affective disorder. From a pathophysiologic standpoint, it is believed to be quite similar to major depressive disorder. So that means lower levels of serotonin, norepinephrine, glutamate. That being said, the exact pathophysiology is not well understood and is still being studied. As far as treatments go, there are two big treatments that are kind of kept in mind. It's relatively similar again to major depression. So one is actually, because remember we're talking about a lot of the reasons why seasonal affective disorder comes about is because of lack of sunlight. So I think places with a lot of snow and lower amounts of sunlight during, say, when we rewind to go back in time. So we're thinking places like Michigan, which is where I come from, as opposed to where I'm at now in Texas. A lot less people have seasonal affective disorder. Michigan, though, seasonal affective disorder is something that occurs with higher frequency. But I digress. So again, treatments, bright light therapy, and SSRIs have the best evidence and are used the most often. That being said, things like being social and other things that kind of help with social factors that help with major depression also tend to help with seasonal affective disorder. Thank you for watching my presentation on seasonal affective disorder.